Mr. President, I also ask unanimous consent to set aside the pending amendments and call up my amendment number 349.
Is there objection? Without objection.
Mr.
Clerk will
President,
report the amendment.
Senator from Ohio, Mr. Portman, proposes an amendment number 349. At the appropriate place, insert the following.
Mr. President, I ask unanimous consent that the reading be dispensed with and that we...
Without objection.
Thank you, Mr. President. So we're here talking about the budget, and one of the issues in the budget is how we spend our money, including on health care, and in this case, some of our most vulnerable young people, our children, who have what are termed to be complex medical conditions. I appreciate the fact that Senator Bennett is co-sponsoring this amendment with me. It's based on some bipartisan legislation we've been working on over the years that helps to ensure that these children have the opportunity to get better care, and also that we can save some funds in what is a very inefficient Medicaid delivery system now for these children. It would allow basically healthcare providers to deliver healthcare services to these medically complex kids through models that coordinate care between providers, again, helping to improve quality of care and much better outcomes in the cases where this has been tried, but also to lower costs for Medicaid. There are roughly 3 million children who fit in this category. It's about 1 in every 25 children. Of these children, by the way, most of them rely on Medicaid to access care, about 2 million out of the 3 million. Although children with complex conditions represent only about 6% of pediatric Medicaid patients, they comprise about 40% of the costs. So 6% of the kids, about 40% of the costs of all Medicaid spending on children. Children with these medical complex situations, they tend to have multiple and high acuity and chronic conditions that often require the service of a lot of different specialists. These circumstances just call out for better coordination of care, particularly because a lot of it goes across state lines. So each Medicaid program in each state has some different rules, but specialized care often requires these children to go to specialized providers outside of their state. This amendment would correct that fragmented system those kids sometimes encounter now when they do seek that access across state lines. Not only would the amendment ensure medically complex children have access to necessary care, it again would also allow the Medicaid system to realize savings through these increased efficiencies, including reducing hospitalizations and emergency room visits, while providing the array of outpatient and community services and support that are needed by these children. So it's a more holistic approach to their care, avoiding, frankly, some of the costs associated with emergency room visits and other hospitalizations and other fragmented care. It's based on the experience in the real world. So there are programs that are doing quite well at improving these outcomes and saving costs. Some of the great children's hospitals have established a track record in developing these care coordination models for kids with medical complexity. I've seen it in action in Ohio, where we're blessed to have a number of great children's hospitals. I have talked to medical professionals who are very pleased to have this better coordination of care. More importantly, I've talked to the parents and talked to some of the children themselves who are ecstatic about it. You know, many of them received their care through a different process previously that was not coordinated. And what they tell me is they are deeply grateful for the coordination. Partly it saves them a lot of time and effort, partly because they're getting much better care, partly because they just feel like somebody cares. And they're getting the love and support and care that they need through the coordination. They are grateful for the difference. As the overall population of children with medical complexity continues to grow, thanks to some great advances in medical science and medical care, including care for premature babies, we're going to see more and more of this need for better coordination. So again, I want to thank my colleague, Senator Bennett, and many others on both sides of the aisle who've been involved in this issue over the years. This is an important amendment for us to have in the Budget Committee because it shows where our heart is as the Senate, to be able to take better care of these kids and also have more efficient care in the Medicaid system, where again, 6% of these children now comprise about 40% of the costs in Medicaid for children. I encourage all of my colleagues to support this common sense approach to provide better health care outcomes for some of the most vulnerable of our nation's children. And I yield back my time.